Good afternoon. I'm Paul Irwin. I serve as your Dean in the School of Public Health. And it's my pleasure to welcome you to this career conversation, as we call these. This is something that we started with Dr. McCormick back last year, an opportunity for us to have just that, a conversation with an alum who has taken their degree in places where you may not necessarily expect, maybe in some places where you would expect. But this gives us an opportunity for you to hear from someone who, in a manner of speaking, was where you were sitting some time ago. And so an opportunity for you to get engaged. After I introduce our guest, Mr. Doug Edgeton, I will then set off on a series of questions. If you have questions, as I'm asking my questions, don't hesitate. Go ahead and jump in at that point. You don't need to wait until the end of the session for you to come up with 2 or 3 questions, although we certainly will provide that opportunity as well. So jump in at any time. So, Doug, if I might.
Sure.
Welcome back to UAB.
Thank you.
We're so appreciative of your being here. Glad to have you back here. I'm going to tell you just a little bit about Doug Edgeton and then allow him to tell his own story in the questions that I have of him. He grew up in Huntsville, which is in the northern part of the state, for those of you who aren't from the state of Alabama. He did his BS in Hospital Administration at the University of Alabama at Tuscaloosa, in the early 80s, and then followed with both his MPH and his MBA in what was already then a dual degree program in 1987 and 88. Decided to stagger the years of graduation, but did the dual degree program at that time. So one of the early participants in that MPH MBA dual degree program. So with that, though, I'm going to allow you to tell us a little bit about your career path. You're now the president and CEO of NC Biotech, which is located in Research Triangle Park near Raleigh, North Carolina. How did you get from Huntsville to Raleigh?
It wasn't a straight path. So a lot of turns. Some things worked out the way you think they're going to, others you don't. So I had a dream of being a hospital administrator. My mom was a nurse. My dad was an aerospace engineer who had responsibility for a lot of management things. And I thought marrying those 2 careers would be an interesting way to live your life. You know, you're helping people, you're doing things, but I was not going to do the blood or any of that. I didn't want to do that stuff. So I said, I can't do the medicine part, but I can certainly do these other things. And so I ended up going to Alabama and getting an undergraduate degree in hospital administration, and ended up, one of the program requirements at that time was a novel thing called an internship. You don't do those much anymore, right? So I was able to meet the administrator of University Hospital and convince him to take his first intern. So I was the first intern at University Hospital and worked as an administrative intern, mainly doing odd projects for him. But when I graduated, they were kind enough to offer me a job. Now, it wasn't a great job. It was not one of the jobs I said, hospital administrator. That was not it. I counted money in a room full of safes and alarms because they were having trouble passing audits, and they needed somebody who could take care of all this cash. And so I learned and put systems in place. And so I became kind of an in-field utility guy. If they had a problem, they would ask me to work on it. So parking was a problem. They didn't know what to do with a lot of the parking stuff. So I had this idea that we had a problem. You walk around the medical center with 72 entrances into the hospital, and every time you would walk on the street around anywhere around there, people would pull up and say, where do I park? And so we would say, gosh, well, that parking deck right over there, but it's full. So you're going to have to go a couple of blocks further. So,
and these are
patients and visitors. Yeah, patients and visitors to the patients. So you're thinking, okay, how do we solve this problem? Well, I was, it just a happenstance, I'd gone to something in New Orleans and left something in the car, and they took me up to their valet parking thing, and they showed me how they ran that system. And I came back and I said, we ought to do that at the hospital. We ought to have valet parking. And I was in a position where I could talk to the administrators regularly, and I was regularly reminded for a while, hey, why don't you go get my car and bring it on around for me. But then one day, Jim Moon was the administrator of the hospital. He called me and said, hey, Doug, I kind of been thinking about that idea. You think you could do that for us? And I said, yeah, I can fix that problem for you. He goes, can you get it going in about 2 weeks? So I said, oh, boy, that's tough. Well, we started off with just a couple of drivers, and they were all executives' kids. And the kids would want to race the cars, and so I was always having to let them go. But then a guy was standing out there, and he was like 73, and he said, hey, would you hire me to do this? And I said, you bet. So, yeah, and then he came to work every day. He was never late, and he said, I have a friend. And so next thing you know, we're the largest employer of people over 70 in the state of North Carolina. So we had all these people who just referred each other to us. And that kind of led to me being introduced to people who were interested in why the hospital's census rate went from the low 70s to the upper 80s.
Percent.
Yeah, percent, which is a big deal in terms of money. So the more full, the more money, the more patients you're seeing, the better treatment. They looked at all the marketing programs and all the things they'd done, and they said the only thing that we've done differently is valet parking. And so valet parking was at that time attributed for a lot of the good things. Well, a lot of people got promotions, and a lot of people got, thank you, Doug, appreciate that. And so I was like, well, great, that's good. But in turn, I met these people. One of them happened to be the chairman of the board of trustees for the university system, a guy named Enid Camp. And Mr. Camp immediately started talking to me. He goes, you understand people, and this is very important in this business because we're dealing with people every day. And he said, I'd like to take you to lunch. So we started going. I would talk to him, and then he would introduce me to some other people. And then lo and behold, things are moving along, and I need a reference for a job. And when you've got that guy giving you a reference, it really helps. And so, it's a part of my career has been learning how to network and talk to people. But my whole thought has always been, how do I help? There's a problem. What can I do to solve it? And if people sort of saw that in me and they said, okay, here's somebody we can give more and more responsibility to. So I moved out of the parking world, and we were the first hospital in the country to do valet parking, by the way. And that was a big deal. But then I was an administrator for an alcohol and drug rehab center we had out in Chelsea, Alabama, and I got to open it and I got to close it. It was a tough time because it was a much needed program, but they hadn't looked at the business plan for a couple of years. So that ran into no reimbursement. You can't stay open. So at that time, my wife was about 5 months pregnant. And so we closed it down, and the only job open at the time back in the university was the director of parking. And I said, man, what did I do? But I knew something about it. And so I said, well, I'll do this for a while because there's no hospital administration jobs at the time. So this is the zigs and zags, that you have to do. And so I said, I'll plan to do this for a year or maybe a little longer. Well, 2 years, 3 years go by, and we're doing really well. We were losing money, and so I put the business skills I'd learned in the business program to work, and we turned it around to where it wasn't losing money anymore. We consolidated all the parking operations between the hospital and the university, and it became something that was at least cost neutral and provided a lot of service to the organization. And through that, you get to know all the administration, and anybody who ever gets a parking ticket, I knew them. I knew them all. So I went to jury duty one time, and the judge says, you're excused. I know Mr. Edgeton. So I had to help him with a ticket one day. So anyway, funny job, but it was experience that I never would have thought I would be doing with 2 master's degrees.
I'm gonna interrupt you right there,
right.
and because you got your master's degree up by that point. So before you continue your career path, what was the motivation for you to get your MPH?
Sure. So there was a couple of things going on in my life at the time. Well, one of them was I was working in the hospital and I had a desire to become an administrator, and the requirement was you had to have at least a master's degree. So I started looking at programs and thought, well, there was the Master's in Hospital Administration program at the time, and they required you to be a full-time student. And I said, I got a full-time job in hospital administration, probably not going to work for me. I looked at the MBA, and then the MPH MBA together was a real attraction to me because it hit both sides of what I like. The public health piece of at that time, there wasn't as much thought around public health as some way other than you were going to work for the state or do something like that. And I was thinking, no, there's a business side to this too, because anything you're doing to help people, there's always going to be some way you can help, and you can also get a win-win relationship going. So that's what got me into the MPH program, and it was also very convenient because it was right next door to where I worked. So I was a full-time student and a full-time employee, and that was not easy but 3 years went by really quick. And I have a son who's about the age I was when I was doing that. He's complaining about something, and I said, yeah, I don't know, man. When I was your age, I was doing a couple things, and I don't believe you were doing it like that. So anyway, so now that I'm on the older side of things, and I can remember what it was, the reason why I did that, though, was I really thought that having a master's degree would differentiate me in the marketplace, and that was very important. I knew for sure it was required where I wanted to work. I wanted to work at University Hospital, and so it put me in a great position. And when I finished, I became the administrator of an alcohol and drug rehab center we built out in Chelsea, Alabama. And great thing to see right off the bat, though, we didn't have reimbursement. We didn't have an up-to-date business plan. We didn't have a negotiated contract with Blue Cross. So I went to Blue Cross, negotiated the best rate they ever paid anybody in the state of Alabama for alcohol and drug inpatient treatment. Unfortunately, it was only about half of our per diem, so not a sustainable model. So went back to administration and said, this is a problem. We had some other issues with some delivery, and they said, we're going to close it down. Here I am, my wife's about to have a baby. So parking comes in. I did a good job of parking, met a lot of people. A job opened up in the School of Medicine, and it really did kind of focus on all the things that I like to do, problem solving, solutions around space and space management, doing the business side of what we do in medical schools. But, there is ultimately public health that's written throughout the medical school. What we did there was very important. And so I spent about better part of 10 years as the chief business person for the School of Medicine. And one day I got a phone call from a recruiter, and they said, hey, Wake Forest is looking for somebody. I said, no, thanks. I'm about 4 years from retirement here. I can retire in 4 years, and I'm not that old. And so they said, well, would just talk to us. And so I sent them the stuff, and then nothing happened. And I was mad and immature. So I was like, gosh, you should do something good for me. And then about 3 months later, they called me back, and they said, we're sorry, we went silent, that we had another candidate, and it fell through. We really want to talk to you. And I said, well, I'm not going to talk to you. And but I had nationally become fairly well known in medical schools for some of the unique programs we were doing in the School of Medicine. And there's an association called the AAMC, the American Association of Medical Colleges, and I was in the business development group of that. And so this recruiter was very resourceful, and they called the guy who heads that up, the AAMC, and they said, do you know this guy? And he goes, yeah, well, I know him. He goes, would you call him and talk to him? So he called me up and he says, you really need to talk to these people. This is a really good deal. So I did. Jack was very kind and told me what they were doing. So I said, well, I won't do it if it's not a vice president. And so they called me back and said, Mr. Vice President, we would love to hire you into this job. So I got the job and spent 12 years at.
And it wasn't parking.
It wasn't parking. It wasn't parking, but parking was in there. So I was the chief business person for the Wake Forest School of Medicine for the better part of 12 years. And during that time, we expanded our campus and built a downtown research campus of 260 acres, 1.2 million square feet of new buildings, actually taking old buildings and converting them into new buildings. There's a story. because Reynolds Tobacco had a lot of this property. And I went to the chairman of the Department of our Public Health, a good friend of mine, and I said, Greg, I'd like to move the Department of Public Health into one of these buildings down there. He goes, no way will we ever move into a tobacco building. I said, when we get finished with it, you will never know it was a tobacco building, and you will be grateful that you have this great space because your department is spread around 14 different locations. And I said, I think we could really make this work for you. And over the course of the 6 years or so, we finally got them there, and now you couldn't blast them out of that space with dynamite. They really, because it makes a cohesive unit. And so then we kind of changed our medical center, and I became the head of the business for our hospital was separate from the medical school, and we were going to merge them. So I headed up all the business for that for a couple of years while we were looking for a CEO. When you bring in somebody like that, then you realize now it's like I'm going through a career and I'm going, this guy doesn't want somebody like me who had all these plans to do stuff in his nest. And I thought, well, we get along fine, but he just wants me to do one little thing, and I've been used to doing a lot of stuff. So I said, I think I'm going to start looking for something else to do. And that's where the North Carolina Biotechnology Center came in. I looked at a couple of universities and looked at running a big research lab up in Michigan. And the Biotech Center does stuff that is really in all this space. It touches everything from food and agriculture to the most cutting edge science that you can imagine. And we're sort of in the early stage, so we help bring things out of universities. So we have grants that will help somebody get to a failure faster in the state of North Carolina. They have to be one of the universities. So we'll give a grant to a university to help move technology forward. Or we make loans to early stage startup companies that are in North Carolina. So we bring things out of the university. We work very closely with these groups to fill their needs, and a lot of it is finding funding. So we bring in venture capitalists from around the country to support their businesses and help them grow. And then, so that kind of got me up to the point where we recruit companies from around the world. And so we are frequently sending people to Europe and Asia to talk about the benefits of being in North Carolina, to look at our university systems, look at the job market we have, and how does that help their company succeed. And so in the last 6 months, we've had 8 big announcements. Most of them are in the 100 million plus expansions, and about 1,300 jobs. So that kind of entails a lot of what the Biotech Center really does is technology-based economic development. And that is taking the technologies that exist in the marketplace, finding a way to create this ecosystem around that attracts both startups, small companies, and then small companies attract large companies. And then it's how do you fill the talent pipeline to keep them all going. So we are constantly working with universities and the community college system and now K through 12 to how do we get people interested in these kind of hardcore science and biotech jobs. We had a great meeting the other day with the UNC system and some of the companies that do the biomanufacturing. And the students that were there said, well, we really don't want to work in shift work. These things work 24 hours a day. These plants are too expensive. They're billion-dollar facilities. They don't ever go down. They keep them running 24/7. I don't want to work shift work. Well, it pays about $100,000 a year. I want to work shift work. So I'm happy to do that. So we've been working to make people aware that, what goes on in these GMP facilities, you don't really see.
GMP?
Good manufacturing process. It's a regulated process, so anything that's going to go into humans, any pills, nasal inhalers and all that, has to be manufactured in a sterile environment. And there are a lot of requirements around how you do that, which is kind of like a public health thing. So, so we work very closely to help those students see there are pathways for them to find a job. Yeah. So,
and
I'll talk forever, so you can interrupt me.
And as I know, you know full well how important employment is as a fundamental social determinant of health. Right. And the thought and the focus that Doug has in thinking about the long-term impacts of employment on what it is he's doing and what he's trying to affect in North Carolina. One of the things that you mentioned that you were identified as having a skill that you had is what we might think of as a soft skill, and that's how to deal with people, how to communicate, and the importance of that. What are some other skills that you gained as a student at the School of Public Health in your MPH or your MBA that really prepared you early on for a career in your field?
One of the classes that I had, it still sticks in my head, remember very well, other than Pete and Jack's strategy class, was it was medicine for non-MDs. And this was a time when you could do things a little bit differently. So we were required as a student to go participate in a delivery, go work in one of the emergency rooms, and just for one day, and then participate in grand rounds. And so I was just blown away, because first of all, the medical terminology was very difficult for me to understand at the time, because I was like, I've not done this before. But then to having been working in the hospital, looking at really the hotel side of how you run this operation, not so much the delivery side. So this really opened my eyes to how to work with medicine and doctors. And so the business school side of it helped me to understand that doctors aren't always the best business people, so they need help. And so I made it my business to find out who needed help. And if they had somebody who was trying to start a company, I would help them with their business plan or talk to them about what they were doing. And this was pre-Bayh-Dole, which was the act that allowed universities to own the intellectual property and move it to the marketplace. So prior to that, people would just go out and start a company and not tell you about it. And then if it didn't work out, they'd come back to work. And if it did work out, you wouldn't see them again. So I worked with people to try to help them find ways to create the opportunity pre the licensing office here. I remember talking with our provost at the time, Ken Rusin, saying, we really need to get into this and start working on how do we help commercialize this work coming out of the labs, because there's a lot of good stuff just sitting on the shelf and it can help people. And ultimately, that's what we want to do. We want people to find those cures. It doesn't do any good if it sits on the shelf and you've got all this patented stuff that's not happening. So there were several runs at trying to create the, I don't know what we call it now, the Intellectual Property Office at the time. And some failures, and then it's now, boom, taken off like a rocket. So like a lot of things, it happens gradually, and then boom, it happens. So.
Any other experiences you want to share about your time as a student here, other than war stories about Dr. Ginter and Dr. Duncan?
So I think that as a student here, your opportunities to meet and talk to people are greater than you will find when you first start working somewhere, because you've got a willing group of faculty and administrative people who are happy to talk and introduce you to people, and they have great experiences, and so they have great connections. And in my world, what we spend a lot of time doing is just bringing people together. So we're what we call a great neutral third-party convener. The Biotech Center works very hard at that. And I think that faculty are very good at doing that for you as well. And so just, remember that they're here to help you. Nothing that they would rather see is than you succeed, and congratulations on getting the job. So that's the kind of stuff that I'm sure makes everybody proud to see you getting into the workforce where you want to be, doing what you want to do.
And this circles back to Clementino's request for you to be a part of the homecoming. This whole notion that your biggest and probably longest lived network are the people sitting right next to you right now. One of your fellow classmates was a fellow by the name of Bill Roper, who's currently the interim chancellor of the UNC system, previous director of the CDC, and dean of the School of Public Health, and then medicine at UNC. And you like to tell a story
I'll
on
tell
him
you
that
I'll tell a story on him.
Even in his absence.
I've told it to him several times. I always take credit for it. So I was in, I think it was John Waterboard's class, I believe, And
Where's John? I'm surprised he's not here today.
and Bill was in the class too, and he was an MD, hotshot guy on the way up, and he was a smart guy. And Sandra Hewitt, Sandra is an MD, and she ran the largest public health clinic in the United States in Greene County, Alabama. And so Sandra went on to become a trustee for the university system. But so because of their two jobs, they were always really busy. And so Sandra would ask me for my notes, and I would give her my notes. And then Bill would ask Sandra for her notes, and she would give her notes. So I told Bill when he became this big dog, I said, Bill, I see him, I said, you need to go ahead and thank me now, because you wouldn't be anywhere near it. You wouldn't have passed that class without my notes. So, but we laugh about it. So I'm pretty sure he would have passed. So on the MPH side, the things that I saw were, how do you take care of populations and how do you make it cost effective? Because that's the part that we run up against as a public policy issue all the time. So we've created this, I'll give you a story. We created this thing called the North Carolina Precision Health Collaborative. And we started off because we had a couple of researchers in the different universities working in a silo around these problems. And we're being this neutral third-party convener, seeing here's an opportunity to help streamline this process and make it work better and get the benefits of this out further. So we don't know what's going to happen in precision health yet, but I'm pretty sure it's going to change the way medicine is going to be delivered in the future. And we look at that in our office and go, wow, that's going to change the way medicines are made. Well, we make a lot of medicines in the state of North Carolina. We have these big production facilities geared around making 10 billion pills a year. And you're going, okay, if this changes to very customized small batch manufacturing, how do we help feed this back into the manufacturers so they're seeing this change? And believe me, they're already looking at it going, oh, we want help. We're going to need people who know different skills now. How do we train those people to follow protocols in a different skill set than what they've been doing? So it's this continuous cycle of change, which, that's what life is, really. It's a continuous cycle of change. And what we're seeing is an opportunity to bring public health skills together with connectivity and then the business skills side of things. And we have in our organization, I think we're about 70 employees, and we employ, I think it's around 22 PhD level investigators, about 14 MBAs, and then a staff of folks around that. And the reasons why we employ that skill set is because when you're looking at technologies that are a new idea coming out of the university, it may be, mostly it's been molecules, but we have started looking at things like devices and other things, and now cell and gene therapy related activities. CRISPR-Cas9, how does this affect plants? How are we going to, food is the first medicine. How are we going to grow enough food to help the world here? And we've had great speakers because we have this program. We get some very great speakers. And a fellow that used to be the head of New Mexico's agriculture, he's quite a renowned speaker. And he came in and he said, it's a great day to be alive in America. And he said, what you don't realize is that we can produce enough calories to keep everybody on this planet alive right now. And if you go back to the 13 and 1400s, half of the world's population didn't have enough food to eat, so they couldn't be productive. So you start looking at the public health side of that, and then you go, but they can't be productive. They can't take care of themselves. They can't feed themselves. So that's kind of getting over into how do we help people with their lives get better to create meaningful pathways into their life, and that's kind of gets into this business side of things. So roundabout answer. Yeah.
And with a discussion that we had earlier, one practical example of that is with precision medicine. You might be able to indicate, well, this particular pill will work well for this group of people, but not this group of people. That therefore, rather than making 10 billion, we'll make 2 billion or even less. So a direct connection there between the population health version of precision medicine and business as well. Doug, you mentioned food, you mentioned food supply, and something that we had a conversation about earlier. Talk about the environmental footprint of the work that you're involved in.
Sure. We work, you wouldn't think that a biotech center, what we do, really has environmental impacts, but so a couple of our researchers are working on things that near and dear to my heart. One of them is chocolate. There's a big problem with cocoa, or they call it cacao, but cocoa. There is, because of changes in their environment, the global warming, you look at this climate change, it's shrinking the area. There's just a small bandwidth of where cocoa grows. And also the change is causing a blight to affect the plants. So we'd started working on a natural colorants project because a lot of the industry, we look at our farmers and say, how can we help our farmers produce more yield, or maybe an off-cycle crop? And one of the things we started working on was the natural sweetener, the stevia project. And that led us into North Carolina grows a lot of purple and orange and other colored sweet potatoes. Are there things we could do with that? So we got connected with the people at Mars, and they said, hey, come on up. So we talked to their science people, and they went through the process, and they said, yeah, if you can come up with some colorants, we're really interested in that. But if you can help us with the cocoa plant, that was like a great message for us, because we have NC State University, A&T University, but we also collaborate with universities across the Southeast, because what we're looking for are solutions to problems. So many times industry will give us a grant and we will manage it to the various universities. So it doesn't always have to be in North Carolina. So this is one we're trying to get Mars to fund right now. So it's a work in process that would maybe look at the cocoa plant going forward. So environmental footprint also goes back to our building and what we do as our programs. We've got a LEED Silver building. We work hard to keep it LEED Silver. Our staff, we've worked on their health and their impacts in the environment. We try to recycle as much as possible. We did a cleanup week. We started cleaning up. We recycled 4 tons of paper in 1 week. We have a conference center that has 35 to 40,000 visitors a year, so you have lots of food coming in, but not all of it is eaten. And we realized instead of throwing it away, we could do something with it. So we've donated about 20,000 pounds of food to the food bank. So we're just trying to maintain sustainability wherever we can. I was fortunate to have 2 parents who instilled strong work ethic in me, and would not let me sit around and not do things. So when I realized that we were going to close the drug rehab center, I thought, well, what can I do? Where would I go? And I looked at the university because I'd been here. That was my place. And so I'd been here that time around 10 years or so. And so I said, I'll look at the university and see what jobs are open. And I was looking at it more from a job, not a career, but what can I do to help me bridge to the next big opportunity? And, everything you do, as long as you work diligently and try to give value back, there's a lesson. You'll learn things in there. And I learned a lot about people when I ran parking. People are at their maddest when their car's towed away. Let me tell you. I had to go to faculty and talk about raising the rate of parking fees at a time when people didn't want to hear that. And I got a standing ovation afterwards. So because I explained to them, I said, here's our financial problem. This is a business proposition. This is what it costs to build it. And this is how long we have to amortize it for. And, we can either make it smaller and not solve the problem, or we're going to have to charge a little more. And so, it's a real nice conversation. I was very nice about it. But anyway, and that was in the School of Arts and Sciences. So that was a very unusual thing. So I learned that life is full of twists and turns, setbacks. Things are going to happen. Now I live them through my kids, what theirs are going through. And, I faced a career crisis when I was like, what do I do? I was the chief business person for a major medical center, making really good money. I mean, won't lie, it was a really good income. But I was working like a lot of hours. I was at meetings at 6 a.m. and I would stay until 7 or 8 at night, have meetings with surgeons that go to 1 in the morning. You're working all the time. And when we changed the medical center, I realized I wanted to do something different. And this time I had the luxury of choosing what I wanted to go do, as opposed to I have to take a job right now because I'm trying to, put my family together. So different points of life, different realities. So you take those into account and you go, where am I at? What do I need to do? How do I do this most effectively? And at the same time, still move towards my career goals.
But it was a luxury you earned.
Oh yeah, I did earn that. I think I did earn that. Yes, I would say that, yes.
And I appreciate so much getting back to an earlier part of the conversation when you talked about after graduating from University of Alabama in Tuscaloosa, the importance of the internship. And I can't emphasize that enough. As you think about your internships, think very carefully and very strategically. It might not be the exact thing that you want to do, but it might be the place and the people or the environment in which you want to work. So hospital administration, look at a hospital. The parking job or whatever might not have been the gig that he really wanted as the first stopping point, but it was a first point. And very often we see huge success where those who do internships and get employed by the place of their internships, it's an enormous impact on both you and your employer. So I can't emphasize that enough.
We have a couple of interns at our place right now, and both of them have said, I'm finishing up for the summer, and so they're saying, I now know what I want to do. This is for sure what I want to do. I like this. This is really, they're doing some social media things for us. And so they said, this really helps solidify, because I didn't know before what the job was like. Now I know what it's like. So.
Well, that leads to the next obvious question for me is, in an intern or in an MPH graduate, what are the skills that you're looking for? What do you need in your workplace?
So the Biotech Center is very broad in what it impacts and where it goes, but not really deep. So we are really about relationships, building relationships, working with our partners, working with universities, working with companies. And so we look for people who have good soft skills, that are good with people, understand how to work with people, but have some subject matter expertise. We hire a lot of program coordinators, project managers, people who understand project management, how to be effective in putting together a thought process. We also look for specific skills. When some of our positions are very much geared into deep science. We've got a neuroscientist, so everything that we do, a grant or a loan around neuroscience, she's our reviewer, looks at this. So our grant program and our loan program are very well regarded. So a lot of the universities will consider a grant from the Biotech Center in their promotion planning. So because the vetting we do is just like an NIH vetting. We actually, the guy who used to run that came out of the NIH, so he set it up, and we use internal reviewers and external reviewers. We also, in our business side where we make the loans to companies, we look not only at the technology but the management team. And so the venture capitalists look at us as a good first vetting of a company to whether it's a worthwhile investment or not. They will still do their own diligence. But if they've gotten funding from the Biotech Center, that kind of opens the door, because what we knew, we don't have a lot of venture capital available like Alabama. We don't have a lot of venture capitalists in North Carolina. There's 2 big life science funds, and they're now so big that they're investing mostly out of the state. So what we have found is our connections in California, Boston, and New York, they will come down to the Biotech Center and we'll do pitch days for them, and that leads to a lot of funding for these small companies. But it's just all about how do you build those relationships and how do people know about what you're doing. So.
Knowing what you know now, what do you wish you had known when you were sitting where these students are sitting now?
Well, like a lot of things, you never know, you won't know everything up front. So that's one of the things that I think is really important to know. You won't know everything. You've got to experience things. You're going to have ups and downs. I was responsible for putting together a 120-acre research park in the downtown Winston-Salem. And when we started it, we thought, this is going to cost, $30, $40, $50 million. Now, there's over $700 million invested right now. And it has taken twists and turns to get that done. But so what I learned was in that and in my career is I couldn't plan for everything. So I had to learn to be adaptable. And so some people like absolute certainty and everything and want to know to the nth degree what will happen. And if you can make that happen, that's really a great thing. And I'm pleased for you. I had to learn to be really flexible. Jack and Pete can say I wasn't the best student. I did okay, but I wasn't like knocking the A's out of the top of the class. But I determined, and so it helped me learn more about my determination to meet the goal and accomplish the degree. And I was trying to get it done in a time frame because I was working against the clock. I was coming up in my career. I needed a master's degree, and I wanted to get it done. So I said, okay, I'm going to put my mind to this and get it done. So I gave up nights and weekends for about 3 years, and it was a good experience for me, and I wouldn't trade it for anything because although it didn't immediately pay off, hey, you got 2 master's degrees, come run parking. So, that's good. Thinking I might could do more with that, but I was willing to do that because I saw UAB as a growing enterprise, and those who've been here have seen it, what's happened. I mean, I remember the first building, the first education building was the engineering building down the street where there's a parking deck now. And then you had the hospital. And so now you see this massive campus and all the things going on. So I'm very pleased to see what's happened with UAB. So, and the other thing I would recommend to people that I didn't think of when I was in that is that for your first job, who you work for, who your boss is super important. So you pick them as well as they're picking you. You want to interview them because that first boss can have a big impact on what you do and how you do things in life, and they can be a great mentor and a great asset to you. Or they can be the kind who just go, you're just a disposable asset, I don't need you. And I've watched a lot of people work for people like that, realize they were the top of their class, and they just were treated like a commodity. Whereas I was very fortunate. I had a great first boss. He took care of me. He looked out for me. He told me when I was dumb and doing not good things, and I needed to correct myself. And he had colorful use of language back in the day, so, but descriptive, very descriptive. So anyway, but he would give you the shirt off his back. If you can master a few human interactions and become good at just having good eye contact, talking to people, looking them in the eye, trying to understand their perspective, listen more than you talk, which I'm not good at. So. But I think listening more than you talk is really an important skill set. And you're all adults and you know these things. But I really think that because you've had such a big shift to this not having that skill, it makes you stand out when you are good at it. And so practicing that, learning some I'm really bad at social conversation. People, because of what I've done, almost everywhere I go, people just talk to me about work. And so now I've gotten really bad at how are your kids? What do you do? It's more like, oh yeah, we're going to build this, we're going to do this. But so I think that remembering we're all people, we've only just got so much time on this earth. And so if you can bring that personal interaction to people, you'll be remembered, you will stand out. So just think about it. So.
That word that you use, practicing.
Right.
I can't say how important that is. And it's a way of also reminding you of the mock interviews that we make available to you. And the importance of doing just what you said, and you don't hear it that much, is you're interviewing them as much as they're interviewing you. Think about that when you're doing those mock interviews. Practice that at that opportunity.
early on, but in that particular time, I got the interview, and I didn't know this guy, and he was a very powerful man in the state at that time. I mean, I was like, gosh, I'm talking to the top guy at the biggest hospital in the state of Alabama, and what would he see from me? And so I was immediately saying, that I think there are things that I can help you with, and I will work hard, and I promise you that, I will give you my best at whatever I do. But because he, I guess, had experiences, he said, we have never had an intern before. We'll take the first one we've ever had, and because I can't pay you. So I was like, oh, so I'm going to work all summer? He goes, you only have to work 10 hours for your degree. That was what was required. He goes, but if you want to make this worth your while, why don't you just work here 40 hours a week? And I said, with no pay? And so I went home, talked to my parents. And I said, here's a deal. I think this is going to be a good thing, but can you support me for the summer? I usually worked during the summer. And so I lived in a room in a house on South Side, and very meagerly, but went to work every day, and was there at 8 and left at 5 or 5:30, and any kind of little project that they were having trouble with, they would say, let that intern work on it. And so I did all kinds of crazy things. They exposed me to the buildings, and the hospital at the time was growing rapidly, and they just couldn't keep track of their projects. So I became kind of developed a project management system for them, a graphic so they could just look at a project and know where it was at. And so that and some other antiquated things, which probably look back on that maybe weren't so good. But they cut me some slack because I was a kid. So I was young at the time. I was 19. So, but when I graduated, they said, we would like to hire you. So, and I know they don't do that with interns now. They can't promise you anything. But if you do a good job, I know a lot of places still hire people. We have a great story, speaking of internships, that we have had at Biotech Center. So he just announced he's stepping down at the end of the year, but he's the president of North America for GlaxoSmithKline. You might have heard of them, a small drug manufacturer, only one of the largest in the world. And so their offices are across the street from us. So Jack Bailey was on our board for a long time, and he had to leave because he's got these worldwide responsibilities. But he said, you know how I got started in life sciences? I did an internship at the Biotech Center back when I was in college. He said that solidified for me what I needed to do in my pathway. So he went into sales at first, and he ran through different companies, but he ascended through that organization to become the head of North America, which is their biggest area. So, and now he's going to retire, and we're going to try to get him as an executive in residence, so to finish it off.
So Doug Edgeton, be adaptable, hone your skills, and give your best at whatever job you do end up with, because that will open the door to the next good job that you can do. So thank you for all you're doing. We are proud of you as an alum of this university, and proud for you, and as they say, you do us well.